and we're recording now.
Okay, thanks everyone for coming for this very, very important role as an EpiPen delegate here at Ocean City Primary School in Ocean City, New Jersey. As all of you have already done, your CPR cards have been uploaded, you're current. The Fort Hays State University consents are signed and here on the table. I appreciate your promptness, and I again appreciate you signing up for this important volunteer position. Has anybody ever given an EpiPen before? Yes, so you have some experience, so if you want to add anything to it, please go ahead. I have a lot of things on the table and handouts in front of you and some props, so feel free to go ahead and just take a minute and take your pre-test. And as you're taking the pre-test, I'm just going to scroll to the next slide. Okay, so as you're doing that, I just want to make sure that you know that we have multiple rounds of training throughout the year. And like I always say at the end of training, training doesn't end after this. You can come to me at any time, and my door's always open. So go ahead and always feel free to come see the school nurse to ask questions. The pre-test consists of 10 questions that have answers within the PowerPoint and the presentation. So I appreciate that. And then what we'll do at the end is we'll take the same exam, same test at the end. It'll be just titled post-test. That's already stapled in your packet. So it looks like everyone's done the test, so I just want to go over what you have in front of you. So you can go ahead and just put your pre-test aside. The next one is going to be a gridded piece of paper that you met all these competencies. This is an example. I filled everything out for you and just left the highlighted signature and dated page. This states your competencies, and then I check them off, and that will go into your folder, and you will become an EpiPen delegate, which goes on to the main list with the building principal and the director of student services. Your next piece of paper, go ahead and flip to the next one, is the role of the delegate. Right here, I wanted to make sure I handed these out because the words are tiny, but they're extremely important for you to review and go over. The biggest thing with the role of the delegate is that you are to be called upon if there's no nurse. So if there's a nurse, I'll take care of it. If the nurse is unavailable or we don't have one, that is when they'll call for the delegate. The delegate usually will coincide with the student in that grade or class. So like I said, administration will be made aware after today that the 4 of you are on the list. So this is an important document, and then we always talk about the Good Samaritan law and the protections that you have. And the biggest thing is negligence. If you're an EpiPen delegate, CPR certified, and you do nothing, then you could be liable. So always act, okay? So that's the biggest thing. I think the next thing we need to talk about is in Power School, which is where we keep all of our medical conditions, our students are flagged with a medical sign. That medical sign will be available to you, so you'll know who is actually allergic and has a severe reaction and has medications in the nurse's office. I would also say that after this training, even though we're doing it here in the classroom, that my room is also a classroom. And I ask you to come and visit and take a tour. I do have to continue in your packet. Go past the Good Samaritan. You'll see that there is an example of a food allergy care plan, right? So I just want you to read over that because the definition of anaphylaxis is a severe, potentially life-threatening allergic reaction, right? Very different than, poison ivy or, allergies, runny nose. In schools, we worry about triggers, things that can trigger that cascade of events that can lead to those symptoms on the front The back of the food allergy care plan actually goes over how to give the EpiPen, which we'll get to. So these are very common ones that we have. We have peanuts, tree nuts, shellfish. We've got some pistachios here. We have legumes, lentils. If someone could be outside in the playground and get stung and may be highly allergic to it and have anaphylaxis documented, we'll come back to that. And then they could have a medication or a latex allergy. So we're kind of like familiar with these, being seasoned teachers, but they're important to bring up in this presentation. Okay, so how do we recognize anaphylaxis? The food allergy care plan that you have gives you what to expect to see that you're feeling like nauseous, the person's anxious. There's a whole other slide about this too. But their heart's palpitating, their mouth is tingling, they could have hives, they might feel like they're anxious and feel like something's going to happen. This could be 1, 2, or 3, or a combination of. Thank you so much. And so it's important to know a quick recognition initiates 911. So the first thing you do is you identify, it's documented allergic reaction, they have an anaphylaxis on file, and because it can progress rapidly, so really, really calling 911 is critical. Notifying the building principal, probably going to lockdown. We have a good response time here for 911. We're very lucky. And this is a different type of pictorial that I wanted to show you because that one is not so great on the eyes, whereas this one gives you, the organs, the skin, the lungs, the gut, your heart, and then the neurological things. So I thought that was really, from allergyhome.org, an important slide to include. So we really need to know, who has what and what we're looking for, and then what, 911 being activated. So the EpiPen itself, big part of this is that we understand, what it is. These pens are preloaded with a very specific dose. We have 2 types. We have this one that looks, these are trainers, but we have 2 different dosages. And the EpiPens themselves, the 0.15 and the 0.3 milligrams for 55 pounds and more, and then 54 or less. And when I go over the locations, they're written on the boxes, so you won't have to remember that. Inside the boxes and the locations, which we'll go over, are gloves, and then both of those dosages. So we have this type, and then we have this type. This type, it talks to you, the AviQ. So we're going to be going over those. So each one of you has a trainer, and just for safety purposes, can everyone just make sure that both of their devices say trainer, and nothing is live? Yep. Okay, thank you for that confirmation. Okay, so in general, epinephrine is a hormone that reverses anaphylaxis, but it constricts the blood vessels, so therefore, because when they go into shock, the pressure drops, so it will constrict the blood vessels and cause the blood pressure to rise. It relaxes that airway because it's closing up, and so then it makes it, eases their breathing, and it reduces swelling. So we talked about swelling of the throat, the tongue, the skin is inflammation. So that's what epinephrine is.
Can I ask you a question?
Yes, please. Question.
How come it stops them from throwing up?
It stops the cascade. So the cascade can go down further. So if it starts off at one point and then the gut sometimes, for everyone it's different. So it may or may not stop it from throwing up. But vomiting is definitely 100% a symptom, of something to identify as needing the epi.
Yeah.
But it may or may not. Okay. But it does assist with the gut itself.
Okay.
Can I ask a question as well?
Yes, of course.
Do you need a prescription for an EpiPen?
Yes. Yes. So the food allergy care pen is the prescription. Yeah, it's a doctor's order. So that's the documented, Jane Doe grade 3 is all on there. Their name, their date of birth, what are they allergic to, what medications do we give in addition. It's like, for example, if the nurse is here, we would also give Benadryl, Zyrtec, and possibly even a nebulizer, some albuterol.
In addition to the
In addition, and
EpiPen.
that's on the bottom right of the food allergy care plan. But this is just for Epi, so those medications would be given by EMS. Or
Thank you.
when they arrive to the ER. Absolutely, good question, thank you for that. We talk about, so people begin to have an allergy because that they have this known allergen that they've ingested or been exposed to, okay? So the immediate steps, and I know I've already said this, is to call 911 or have someone else call. And when you're having somebody else call, because there's always someone staying with the person, is you want to confirm that they heard you. So I'm going to say, Emily, call 911, and then you're going to say, Rose, I'm calling 911. And I'm going to say, thank you. And then I actually ask you to go get the pen itself. Or you may stay if I'm the delegate. Okay, we'll go into a lockdown, you know, the radio will start, 911s will be coming, so those immediate steps again. So I did talk about this type, so I'm going to go ahead and we'll take a look at these. And you have trainers, so this is a real one here, that goes along with the yellow, and that's the 0.3 for 55 pounds or more.
Okay.
And then this is the green one. We're not going to be opening because it is live. So I'm going to take them off the table, but that's what they look like, and they come in cases that pop right open, and it slides right out.
And green is for 55 pounds or less, or
Yes, and the
54
yellow and the
pounds or
green,
less.
correct, and it's written on the boxes. Because it's very difficult to, you know, remember those things. Which one am I going to give? Because I don't have a scale.
Is it always blue and orange, or is there
Yes.
an EpiPen Junior? I know there is. They're both always blue and orange now,
Yes, exactly.
because that saying is helpful.
Yeah.
Yeah.
So the EpiPen Junior is the green one, and then that's a 0.15. See?
Okay.
They're both blue, and then orange on the bottom. Cool. So that is a very good question. So that's why I have them up here. It's really important for you to know that they have kilograms up here, but I don't know about you. I'm more of a pounds person, so that's why I converted it. And then we have a different type, which we're going to get to. So what I'd like to do is go ahead and just go through the steps of using this bed. So we've identified, we've called 911, we have the medication, and we're ready to give it. So, yes, as Maggie said, blue to the sky, orange to the thigh. And if you look actually on the pen itself, it will give you the instructions. I also wanted to tell you that there are gloves with the Epi too, so I would always don gloves. Okay, so the first thing you're going to do is remove the safety cap, the blue, and put it down. Right? Okay, we're always giving it on the outer thigh. Okay, may or may not be on the desk. Right, and then you're going to swing or just press firmly, right? Trainer, trainer. And then count to 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, release. And then with a gloved hand, you're going to just massage that area. And as you can see, now the sharp has gone away. It's retracted. And so now it's safe. It's not a sharps container. It can go into this case, because this would be empty, and this would be handed to EMS. So the emergency department staff will know what was administered. All right, so does anybody have and then to just put it back, you just squeeze the orange and put the blue cap on top. Does anybody want me to go over that again, or everyone feels comfortable with the administration?
So you hold it for 3 seconds and then massage for 10?
No, you swing after you inject. You count for 10 when you're injecting, and then you just massage it for a minute or two.
Okay.
You don't need. There's really not a specific time for that, but the 10 seconds is actually holding the needle there. Yeah.
Okay.
And that's what it says on
Yeah,
there.
that's why I was
That's a good
confused. So
question.
Just hold in place for 3 seconds and then remove and massage the injection site for 10 seconds.
Yeah, I'm sorry, I did switch that up. Yeah,
Yeah.
I did switch that. I apologize.
Okay, no, so
Yeah.
we're gonna
because
Hold for
Yeah.
10.
yeah.
We're holding for 10.
Yeah, there's different thoughts on it and different documentation and research, but in general, I like to do 10 and then massage.
Okay.
That's how we do it.
Okay.
But for purposes of this, hold in 3 seconds and then go ahead and massage for 10.
Okay.
So might have thrown that in to trick you, so thank you for paying attention on the
I
slide
just wanted
there.
to ace my test.
That's
I
right.
see that you weren't falling asleep, and it's been a long day. Remember, I've got some little
Teachers
sugar
are
snacks
perfect.
here, some water. Right? So I think that was excellent, excellent. So this one is very interesting. Now these speak, so it's going to be a little bit weird if we all open them at the same time. So do I have a volunteer who'd like to open it?
Yeah.
Go ahead.
All right.
So this is an ABQ. They are also the same colors, but I don't have examples of the real ones.
Okay. Pull it up.
This trainer contains no needle or drug.
Pull off red safety guard.
If you are ready to use, pull off red safety guard. If not ready to use, replace the outer case. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1.
So 5 seconds for that one.
Complete.
Excellent. That was awesome. I really appreciate that. So if you are able to stick the red thing back in, or it will stop, but that's good.
Take it back out.
That's good. So this is important, and I do have this. You guys will all get copies of this PowerPoint. So please look out for it.
That wasn't on my dogo.
Safety
Oh my
guard
God.
and gray outer case.
Oh.
All right, yep. We're just putting it back together. Does anybody else want to open up and listen and try? You don't need to, but does everybody feel comfortable with just in general the steps for this one?
Yeah.
I'm going to pass this around because you can see that the 0.3 for the ABQ is orange, and then the 0.15 for the ABQ is
So why do
blue.
we use, is there a reason that people would do different ones?
Yes.
Okay.
Certain patients, some students have these because it's covered by their insurance.
Oh, okay.
So some insurances will not cover an EpiPen, or the manufacturer might be out. So they'll be back ordered. So there's multiple reasons. I would say that most of our students have the EpiPen, and if
I was gonna say, do any have this?
yeah, it's a very low percentage, a very, very low percentage. I think I can
Is it generic or?
Insurance?
insurance or availability.
Okay.
So when the doctor writes it, they'll usually just write epinephrine, or they'll write EpiPen, or they'll write ABQ. But there's been a little bit of the front desk might know that,
Yeah.
what's available and what's covered for that patient.
Okay.
But it's different because it talks to you just like an AED, so that's kind of cool, right?
Yeah.
And I feel like when you're in an emergency, you're so nervous that, it's nice to hear a
Yeah.
firm,
Yeah.
confident voice giving you direction. So this PowerPoint's important that when you press here, you'll actually get the step-by-step. If you forget everything, everything's gonna be on the slideshow, on the PowerPoint, and I will definitely get you each a copy of that. You'll have access to that. So after it's given, 911 is coming, monitor the individual just to make sure you can administer a second dose. So these boxes have 2 doses in them. Important to note. 2 doses in this box and 2 doses in these boxes. Okay? And you, within 5 to 15, so around 10 minutes, if they are not getting any better or even beginning with new symptoms, you can give a second dose. Again, same steps. Make sure EMTs have both, that you've given both. Note the times. So if someone is there, have them write the times down. Those types of things. What's occurring? What is the person saying? What is the person from the EpiPen delegate? When do they give it? That type of thing. That's really going to help EMTs when they arrive. So that's wait for EMTs to arrive. And we talked about disposing of the EpiPen itself. If 911 is coming, you give it to them. If there's an EpiPen given here, and for whatever reason, I just wanted to make sure you guys know that just last week I had a Sharps container, looks just like that, installed in my back room, in the medication room. And again, like I said before, very important for each one of you to stop by the office, and I will go through with you where everything is located. Because in the building itself, I have them laminated, but I wanted to really put it up here. When you come down the ramp and around my desk, we have stock medications. Right here is the Epi. And I actually have, there's colored stickers on them now, which they replace on after I made this. So that's one place that they would be.
Are those?
Are there
Good.
names on them?
Yeah.
So, yeah, this is stock, right?
Okay.
So that is for, this is a very good question, because I put this one first, because as a delegate, you're only giving it to someone who has it ordered, right?
Mhm.
So in the medication room, we have, and I know most of you have already been through my office, we have a bookshelf full of all the students' pictures, the school year, their picture, their name, their teacher's name, and the room, and then each grade is color coded, as you know. I have here, each grade has a color. Preschool's orange, kindergarten's yellow, first grade is blue. So you'll easily look. When you get into the medication room, which is when you come to visit, I apologize I didn't take a picture of that, but it has students' names on it, so I wouldn't be able to do that. You will see that not only do they have the picture on the outside of the bin, but the picture is also on a Ziploc. It's a large Ziploc with everything in it. All the medications and the doctor's orders. If the doctor's orders are not in there, there's a medication administration record book, and it's in that book. That means it has been given already, and I had to start a calendar of, actually administering that medication. So
say a student in class ate something new,
Mhm.
but they have not been diagnosed, there's nothing we can do, we have to call you.
call 911.
Call 911,
Yep. So
okay.
we're still going to do everything, but you're not going to give them Epi. Yeah.
Okay.
Yeah, medics will arrive and give them Epi. I have the ability to give them Epi, but as a delegate, you do not.
Okay.
Okay? I have 13 standing orders, and epinephrine is one of them. So that's from our school physician. So the locations, to get back to, is that specific person has been documented. And again, it's in Power School with that medical sign. I'll make sure that you guys all have access to it. I'll put you on that list. So everything is in that bag. And the reason I do that is like the day before, I will go ahead and, if I have a field trip the next day, and I have the big bookshelf, I'll pull out all blue. Because I know first grade is going on a field trip tomorrow. And then whether it's myself or a sub, they just grab that bag, and everything is in there. It's the right person. We have a lot of new students, right? We have a nice enrollment here. I have the parent give me a picture of their child, because I can't wait for picture day, for them to come in. So some of the pictures are really like summer and on the beach and stuff, because we're lucky that we live here in Ocean City. So that was a very good question. So we have two more locations. So does anybody know where this is located?
Right before your office, right?
Yes, exactly. The main office is right here. There's a ramp.
Top
And my office, exactly, at the top of the ramp, and then my office is right here. This is a twist off right here. You just twist it, and it breaks off. And I actually have a little sign that says, twist until broken. Because it takes effort to break that, okay? The biggest thing with Epi in the state of New Jersey is that Epi must be secured, but not locked. So in my office is locked, but the door to the medication room is open. So it's secured in the room, but not locked. My office is locked, but the door is not to the medication room. This is not locked, but secured, and it's up high.
So what's in that one? The generic,
This is EpiPen, both doses, no ABQ.
with all the
and-
kids' names, or just?
No, this is just, I'm showing you in general where they're located.
Oh, okay.
The only ones you guys are gonna use
Are in your-
are the student
Gotcha,
ones,
the ones-
exactly.
got it.
This would
Okay.
be an
Yes.
emergency case if you had to.
If you had to get it.
If you had to get it.
Yeah, exactly, if I had to get it, or, EMTs get here and say, the bag's in the other rig.
Yeah.
We have it.
Gotcha,
Okay, and then the other location that I have is here in my medical bag, which I have here, nice laminated. And then within my medical bag, I only have 5 things in there. First aid, Narcan vomiting, low blood sugar, and allergic reaction. So just for a moment, I thought it would be nice for you guys to just look at those briefly. Didn't want to put too many slides up here, but I opened up my medical bag. So when I have Stockton students, nursing students, and they want to learn, I don't have to open it up and then I'm in the middle of an emergency, I'm trying to put it back together. So the teaching can occur because that teaching aid is there. These are the competencies that we talked about earlier. This is the action, what it looks like, the food allergy care plan, which we've already reviewed. I wanted to give you copies again. I think it's very difficult to see, but the quality of the papers on the PowerPoint is very good. It's nice to have it in your hand. So I encourage you guys to ask any questions or share any experiences. Do you have anything that's confusing? You guys?
I did just think of a question. I did another training with you about Narcan, and I remember you saying that if you were to give it to somebody and they don't need it, it's not harmful.
Opposite.
Okay, EpiPen
Very
would
dangerous.
be. So that's why we're
Very
not
dangerous.
allowed to. Okay.
Correct. Yes, they'll have a very fast heartbeat. They'll feel very anxious. If they don't need it, it is very dangerous. May or may not be on the test.
Okay.
It is.
I was
But
gonna say,
yes,
I think I answered that one.
Narcan, yeah, Narcan, exactly. That it will not
It just
do
made
any
me think of
harm.
it. Yeah.
Right.
Which makes
If
sense.
there's
as to
no-
why we
Yeah, it's
can't
like
give
just
it unless
administer it anyway, just in case. I remember you saying
That's a
that. If you
reversal
felt, okay.
agent. That's a reversal agent, with the receptors for an opioid
Right.
overdose. Yeah. So, and we do have that. You know, we have little kids here, but they're adults and parent-teacher conferences and
Right.
other activities and stuff. So, good question. I just got brand new Narcan last week. And these are provided by our Director of Student Services. So we just got new EpiPens and a new Narcan. So it's very dangerous, yeah, to give it to
Is it
undocumented.
just dangerous? Like, say you thought they were having some sort of reaction, but they weren't having a reaction. Is it still dangerous?
So
even if the
you're still
person
gonna
was
call
diagnosed?
911. It's documented, but you're not sure if they're actually having
Okay.
anaphylaxis. I would do exactly what you said. I would give it, call 911, and it's because they're gonna end up on the monitor, and better to give it than not give it. Because
Yeah.
their cascade can happen quickly.
If they're reacting
If they're
within these things.
Correct. If you, like I said, it could be one, it could be two, it could be four, there could be all of them.
Yeah.
So I know you can be apprehensive about it, but calling
Better to
911
do it than not.
and to give it because it's documented, because it's documented, they went through testing. Does that make sense?
Mhm.
So it is.
I have a question too.
Yes, please.
About the medical bag. So like you have it broken up like Narcan, first aid, allergic reaction, blood sugar, vomiting. That allergic reaction, that's gonna be where we have the EpiPen stuff. Your vomiting bag is like your bag that
Gloves,
they're
the
throwing in.
MSSP,
Okay.
yeah, bag, that kind of stuff.
Just because I'm thinking like allergic reaction, okay, they could be vomiting. So I'm opening both of these bags.
So it's a good question. So that this is, again, that's for undocumented. So documented, right outside there are gloves and vomit bags.
Oh, okay.
So again, this is so important. Come to the office, I will
Got it.
show you,
Yeah.
and that is an excellent question. But that's what I feel that it's necessary in the district to have this, because in an emergency, you pull it out and you have everything you need.
Yeah.
You know, I even have a large head injury, bag ready to go. So that would be an example for the EpiPen. So it's very clear. In an emergency, you don't want to be shuffling through things. You want everything organized in one area.
These things go through the clothes, right?
Yes, yes, 100% goes through clothes. So,
Sorry, go ahead.
yeah, no, go ahead.
Can we clarify one more time how you know when to give the second dose?
Yep.
And do you switch legs or anything like that? Is any of that important?
Oh, that's a good
It's a very good question. I would switch legs, for sure, and 10 minutes. If they have not made a marked change, or they have additional signs, EMTs are taking a long time, that second dose.
Okay.
So excellent
Thank you.
questions, I really
And
appreciate
you said
that.
2 doses come in
Each box.
Okay.
Yeah, again, I'll show you them when you come down to the office. So I'm very excited that you guys came with a ton of questions. So just some takeaways, we learned today to recognize the symptoms of anaphylaxis, understand and how to use the EpiPen, and the importance of immediate action and seeking medical help. I really appreciate for your time. This is a very life-saving role. Again, if there are any teachers or, if you want to take back any comments to your coworkers and they would like to be a delegate, have them just reach out to me. We'll do the same thing. We'll check out their CPR card, I'll make some time, and we'll go through training. But again, thank you so much. I really appreciate it. And if you don't mind taking that post-test, and I really appreciate that you guys stepped up. Okay.